In this video, I'm going to go over referrals. As always with this situation, there's more than one way to skin a cat with this, so if you know of an easier or faster way, please reach out to the group, show us what you're doing. That may help speed us all up. But at least if nothing else, I'll show you the way that I found seems to work most efficiently for me. So first off, you'll probably notice that, as I've mentioned in previous videos, I've rearranged the alignment of my screen and moved my assessment to the top. The reason for this is just for a reason like this, in that usually the assessment plan's where my action items are, so when I open the screen, it's the first thing I see. So you can get to referrals a couple of different ways. First of all, you can go up to the nav bar here, go down to referrals. Secondly, within this nav bar, you've got referrals. Or third, if you are on the assessment or AP details, you can use the top bar here to get to referrals. So once you get into referrals, first things first, as you notice, it'll show their information up there. You then need to pick what you want to refer, so specialty, OB, physical therapy, etc. So let's say I'm going to send them to orthopedic surgery. So specialty, you can either scroll down here or highlight and start typing, and it will start getting you down to the item. Click on what you want. Now from here you have essentially three options. Option number one, if you know the provider, you can go directly to them, add them in, boom, that's all done. Option number two, if you're not really all that specific about which provider, but you have a specific group you'd like to use, then you can always click directly on the group. Click OK, that goes in. The third option, let's say that you want to send them somewhere that is not in our list. So let's say they have an orthopedist at Emory that they want to go to, then you can go down here to the clinical information and type in the name of that orthopedic surgeon. It's also helpful if you can give any more specific details, name, location, phone number, and fax number are also very helpful if you can get those for the referral department. So let's say, just to keep it clean, I'm going to send them to Dr. Kondua. So then you need to tell him what you want to send to Dr. Kondua for, and he doesn't need to treat the diabetes, but he'd be great to treat the knee pain. So let's go ahead and pick that. Service requested, so pretty much most of the time it's going to be consult. Unless you're doing a therapy, then it's evaluate and treat. Reason for referral, you do not have to click on or fill in, but this just has, if you're going to do some specific testing that you want, cardiology, neurology, etc. to do, you can throw that in there. It is helpful to pick a time frame. So this is an area that sometimes means you need to do this in-house, sometimes you send it to the referral department. If this needs to be a stat referral, either you're sending them emergently or the patient's calling you at the last second, it's probably easier to handle this in-house. So if it's going to be less than 3 days, I'd suggest honestly keeping it in-house at this point. If it can go anytime after 3 days, then by all means send it off to the referral department. So let's say I want them to try to get them in with Dr. Kondua within the next 2 weeks. That's great. If you want to put any information in there that will help with the referral, it's useful. This, however, is not where information to a referring or to the provider should go. So let's say I did a steroid injection on the person's knees and I wanted to share that with Dr. Kondua. Well, it doesn't go here. Best thing to do actually is send your note on to Dr. Kondua and let him know that they will be expecting to see the patient. This is more information for the referral people. So for example, or anything of that nature that might be useful for the referring people. And then you have two choices down here, place order or send task. By and large, you really should be doing place order. Placing order will generate a trackable item that you can follow. It also will become part of the patient's note that you can see. When you do send task, it does allow the referral people to tweak your referral order, but there's really, it falls off into the ether and there's no real way to track that. So with that being said, place order. Now generally, what it would do next is it would give you a pop-up of where do you want to send it. You send it to the pre-cert. For me, because I've already done one referral on this test patient today, it didn't do that. But as you can see down here, it's now marked. The knee pain to Dr. Kondua, needs an afternoon appointment. save and close. And then at that point, if you go and look at your plan, it's now mentioned in here. By and large, that's sort of the quick and dirty of how to do a referral. If you have any specific details or specific questions on referrals, by all means reach out to me or post a question in the YouTube question comment section, and we'll see what we can do to narrow it down. Thanks.